Get you one.
Good afternoon. I'm going to call to order this meeting of the Health, Environment, and Community Engagement Committee. My name is Cam Gordon. I'm chair of the committee, and today I'm joined by all committee members. Council members Johnson, Fry, Glidden, Cano, and Bender. We have, looks like, I believe, 7 items on our agenda. We have the first 4 of those that are consent. I'm going to pull the first one off for an amendment. So I'll be moving the items 2, 3, and 4. The second item is to authorize an amendment to the contract with Hennepin County to accept an additional $320,000 for a new contract, total not to exceed $1,191,686 from a federal teen pregnancy prevention grant. This will also be referred to Ways and Means to increase the appropriation and revenue estimate. Item 3 is to set the public hearing for May 12 for the environmentally acceptable packaging ordinance. Item 4 is to refer to Animal Care and Control staff the subject matter of an ordinance amending Title 4, Chapter 74 of the Minneapolis Code of Ordinances relating to animals and fowl, amending provisions related to the keeping of honeybees. So I'm going to move those 3 items, item 2, 3, and 4, unless somebody wants to pull something for comment or questions. Seeing nothing then on those 3 items, all those in favor say aye.
Aye.
Any opposed? Seeing none, those items carry. And on item number 1, which is the approval of reappointments to the Minneapolis Public Health Advisory Committee, I would like to add to the list an appointee from the 2nd Ward of Sarah Noor for Ward 2. And this is the application that came in, but all the applications weren't in by Friday, so part of this is my fault. I wanted to wait till all the applications were in before I made the appointment. This is also supported by the Health Commissioner as well. I think she'll be a great appointment on that. Are there any questions or comments on this? Then I will be moving with that amendment to also appoint Julie Ring from Ward 1, Bertie Cunningham from Ward 11, Autumn Chmielewski from Ward 12, Jennifer Pelletier as the U of M School of Public Health rep, Dan Brady, member at large, and Abdullahi Sheikh from Ward 8. Any questions or comments on that motion? Seeing none, all those in favor say aye. Aye. Any opposed? Any abstentions? That motion carries as well. Excuse me. That brings us to our discussion items. And we have 3 of those. And the first one is our annual report from the Minneapolis Tree Advisory Commission. Welcome. And why don't you introduce yourself and give us your presentation?
Yeah, thank you very much, Chair. I'm Peggy Booth. I'm a resident of the city of Minneapolis and am co-chair along with Lori Strom of the Minneapolis Tree Advisory Commission. And it's our pleasure to present this, give you this presentation. So I'm just going to go through that, and there'll be plenty of time for questions. So this is our annual report to you, which we do each year. The Tree Advisory Commission was created in 2004 by the Minneapolis Park and Recreation Board. Its mission is to enhance Minneapolis urban forest and improve its long-term health. And in doing this, while we are a committee created by the Minneapolis Park and Recreation Board, there's been a tradition of us advising the City Council through your committee and its predecessor. So here's a list of the people that are on the Tree Advisory Commission. It includes representatives appointed by the Park Board. There's a City Council designee, which is Robin Garwood, your chair's staff. We have 2 members from the Public Works Department, a mayor's designee, a person from the Minneapolis Public Schools, a U of M representative, a developer, and then a number of us who are citizen members. Minneapolis is considered by the national group American Forests in the top 10 U.S. cities for urban forests. So before we really get started, I just wanted to give you a factoid or two. We have about 1 million trees, not including those in our woodlands, so certainly we have more than 1 million trees, including 200,000 street trees and 50,000 park trees. We have 31% tree canopy cover citywide, which is pretty darn good being here, a city on the prairie. But I think many of us believe that a 50% tree canopy cover is where we really should be to get the benefits, and I'll talk more about that in a few minutes. In 2013, the city lost over 6,300 public trees, and 5,200, almost 5,300 trees were planted. That did include a loss of 1,800 public trees from the storm in June, which will be replanted this year. So our report today is going to have 3 primary topics: why trees are important, what's killing our trees, and what we can do about it, as well as a series of recommendations. So first, why trees are important. Well, trees of Minneapolis are really the growing capital asset that benefits everyone in the city. Unlike virtually any other form of capital asset that starts falling apart the day you build it, trees increase in value and benefits with every year. They're also sometimes referred to as the Swiss Army knives of environmental benefits because they do provide so many parts of so many benefits. So they are the part of the city's infrastructure as much as streets and storm sewers that improve the environment, human health and well-being, as well as community quality and the economy. Just to briefly illustrate it, this is a diagram that shows some of the environmental benefits as well as a few of the economic benefits of trees related to property values, stormwater reductions, that is to say also flooding reductions, and habitat for wildlife as well as food for people. This diagram illustrates how the more trees that a city has, that is, the greater the tree canopy, the greater the heat island reduction and the fewer days with heat-related unhealthy air pollution. Another series of research has shown that trees also help reduce crime rates. Neighborhoods with more tree canopy cover have lower crime rates. They calm people with ADHD, and they help speed up recovery of hospital patients who have views of trees. With loss of trees, we do lose. And this is a pair of, it's really the before and during, not quite the after, of related to emerald ash borer. And it's interesting, the American Journal of Preventive Medicine looked at data for 15 Midwestern states that had emerald ash borer during this time frame, and they found that deaths increase in counties with EAB, more than 15,000 additional cardiovascular-related deaths, and over 6,000 additional deaths related to lower respiratory disease. In addition, trees provide a lot of economic benefits, and specifically street trees save about $7 million in energy savings, over $9 million in reduced stormwater runoff, as well as $7 million in increased property value. Together, these mean that our trees have about a $25 million value that they provide to the city each year. This is the street trees. So keep in mind that the value, these benefits that we get, basically are directly correlated to how much leaf area we have. So it's every single little leaf that every single tree has that provides the benefit. And those amount of benefits there and can be correlated with the amount of tree canopy cover. So you'll periodically hear us refer to tree canopy cover because it's a good measure or a good indicator of what the benefits are that we are getting from our urban forest. We do have an urban tree canopy study that was commissioned by the city, and this is one of the graphics from it. On the left, the darker the green, the higher the tree canopy cover. So you can see that there are some areas of the city that are over that average 31%, and there are some, primarily the more industrial areas or commercial areas and the downtown, that don't even make it to 11%. The graphic on, or the map on the right, is not the exact opposite of it. Instead, what that shows is where are the actual planting places. So they take out, water and pavement and so forth, and look where there's actual grass or dirt or on the ground where there can be planting opportunities. So this does show that there are planting opportunities in a number of areas of the city. The darker the color, the more of that planting opportunity. So what is killing our trees? Well, the thing that we're most focused on right now is emerald ash borer, because it is already spreading across the city. And as I'll illustrate more in a moment, it will be spreading exponentially. All our ash trees are at risk, and all the infested trees will die. So ash are a major component of our urban forest in Minneapolis. An estimated 38,000 public trees are ash, and over 175,000 ash exist in people's yards. And it's pretty stunning to me to think that while we're putting our attention on taking care of and replacing the ash that are in our public places, we really need to mobilize the private people to do that in their own yards and properties as well. And so as we lose these trees, we will be seeing worse water quality as well as impacts on human health. The trees that we are losing are, in terms of the street trees, typically about 12 to 14 inches in diameter, about 40 feet tall. This shows the ash trees by their sizes. So you see that spike at the towards the left of the diagram is those 12 to 14 inch. But we also have a sizable number of trees that are larger than that. And again, these trees are estimated to provide over $3 million of benefits per year to the city. It's important to contrast our experience with Dutch elm disease. The tree in this photograph is an elm with ash. We have been able to successfully coexist, if you will, through the strong efforts of the Park Board and others with Dutch elm disease. My son, who's now 37 years old, I think, was born when we first started working on Dutch elm disease, and we still have magnificent elm. Yes, they are still prone to Dutch elm disease, but it is an insect that carries a fungus with Dutch elm disease. It's not very mobile, it's not as big a problem, and we've been able to, through what's called sanitation, retain a lot of our elm trees and substantially slow down the spread of Dutch elm disease. That is not true for the emerald ash borer. It's just a much more aggressive insect. It's harder to detect, and once you do detect it, you already have that problem. So unlike our elms, we expect that all of our ash trees are doomed through this. It's not going to be a case of waiting till the big curve of the pest goes through and then save a few ash. That's not what's expected to happen. Also, unlike the elm trees, when ash do die, they're very weak-wooded and they are going to tend to fall down. And these dead trees are a hazard. They'll fall down sooner or later, taking power lines and other property, and hopefully nothing worse than that. But they will do damage if we allow them to fall down. So let's quickly look at the history of losses in the city. 2010, it was initially in the Prospect Park area, expanded in 2011. 2012 continued to be in that area. Then in 2013, there were 4 new infestations. It wasn't that they were necessarily new in 2013. That was the first time the professionals were able to find and confirm the insects. And then as of March of this year, we saw some increases, particularly in the southeast-northeast boundary. And that double circle on the east side of the city is the Southeast Como neighborhood, which is where I live. And so we've gone from 9 trees confirmed with it last year to 70 as of March this year. And I have the irony of seeing my own street clear cut. Even though I'm a member of the tree commission, it doesn't keep me from losing ash trees as well. And this is a chart that has been found to be quite true nationally as emerald ash borer has entered into communities, that you slowly see it increase, and then you have, it's sometimes referred to not so humorously as the death curve, that in this case, in years 7 through 10, you just see this exponential spike in it. So we are there. So you can see, yes, we've been getting a few more trees each year, but we have every reason to suspect that it will substantially increase, along with those loss of benefits, substantial costs, and concern for property. So did this brutal winter make a difference? Well, the university found out that 80% of the of the larvae in the test logs did die at the kind of temperatures we had, but that leaves 70% of a very large, aggressive kind of pest that did survive. So it's our belief that at best it'll slow us down. Maybe it'll mean we're like at year 4.5 instead of 5.5, but it isn't going to change that basic curve. But it may give us some more time to do planned removals and replacements. One of the other types of killers that we want to talk about are those things that are just because of the way we as people interact with trees, how we build things, how we try to, and I think for good reason, put in trees with our urban environment, and what a challenge that is, and how that does tend to cause many risks and struggles for trees. So one of these kinds of invisible killers is putting trees into undersized tree pits. When we refer to tree pits, these are tiny holes in the ground without adequate room for the tree's roots to grow. We use de-icing salt, which can kill many kinds of trees. And we often plant monocultures of trees, leading to more problems if there is an insect or disease problem or a particular problem with that species in that location. We, again, undersize tree pits and strangling wires. Trees are not just a support for decorative lighting, and the wires themselves, particularly if they're wrapped too tightly around trees, will kill trees. And our own public works practices have many times been in conflict with trees. And the Park Board and the Public Works Department are working very strongly together to reduce this kind of damage to trees, but it is still, it still happens. There are still sometimes contractors that are not as careful as others, and there are still some pretty impossible situations in which we have trees and infrastructure trying to coexist together. The university is in the process of finishing the Minneapolis tree failure research project, in which they looked at the storm that we had last June and whether there is a relationship between the failure of trees and recent construction practices, and we look forward to getting the results of that study. Soil compaction is another kind of killer. And another one that isn't because of something we do, but more or less because of something we're not aware of or don't do, is when we have drought, and certainly this week is not one of those weeks, and we don't water the trees, trees will suffer from stress, and they will die. And I think all indications are with climate change that it isn't that we won't have any rain, it'll come in one time of year and not another time of year, and that we will have trees that are doing well, growing robustly, and then have to face a month or 2 or 3 without any rain at all. It's that boom-bust cycle that is particularly hard on our trees. So what can we do about this? Well, again, to reminder that the amount of benefits of our trees equals the amount of tree canopy cover, and that is equal to healthy growing trees, which is equal to having trees in good planting places, plus the kind of care we give them and the water we provide for them. So we can replant what we're losing. And I mentioned I'm on a street with ash trees. Well, 2 years ago, I volunteered to have my ash removed. I saw the handwriting on my wall, or on the wall. And here's my river birch when it was 1 year old, a little hard to see with the green of the yard. But I think a lot of us are saying, let's just systematically and thoughtfully replant what we're losing. We can proactively replace ash with different species of trees and achieve a mixture of older and newer trees and use a diversity of species on each block. We also want to encourage private tree replacement through neighborhood projects, business association projects, and I particularly want to endorse the City Trees program, which the city has been funding for a number of years. And just want to tell you a story. This year, the Tree Trust was using an online first-come, first-served system to make available the trees that it has available through the City Tree program. It was being done through a computer system called Visi. Within the first 7 minutes of the people being able to sign up for trees this year, it not only crashed the City Trees website, but the whole website, just to give you a sense of how anxious people in our city were to have trees that they could plant in their yards. We need to care for the trees we've got, in particular to water the trees, to keep them watered all summer long. It was very sad this last summer to see young street trees dying because they weren't getting the water they needed. We need to guarantee watering for new trees. We need cooperation between the different public sector entities to do that, as well as engaging volunteers and sending out reminders to people to help water the trees that adjoin their property. We also want to keep trees in shape. We need to do regular young tree pruning. $1 or $10 spent now is $100 saved later, because the more you do good young tree pruning, the better the form of the tree will be, the healthier it will be, and the less cost you'll have to do pruning as you get bigger areas to prune off. We need to monitor the health of all of our trees, and we need to give trees and their roots more breathing room and space. I don't think most of us realize that trees need air as much as they need water. And if you get soil compaction from human traffic, that is a lot of feet in a park like this, or from vehicles driving on them or whatever, it does harm that tree. In this case, the park board was using the air spade on compacted soils, but we are also very interested in the product biochar, which some people in the city have expressed interest in testing to incorporate that as a soil amendment to help improve the airspace and the soil quality. Also examples of giving trees more breathing room and space, we've seen in urban planting rehab, where we could take a place where they have had inadequate soil and help provide better growing space for trees. This is an example of a sidewalk, and it's a little tricky to see, but this sidewalk not only curves around that elm tree, but it slightly slopes up. So the sidewalk in this case was built around, up, and over the tree roots rather than a big cut having to be made. And we applaud the city for doing this and like to see more of this done as a way to accommodate both big trees and pedestrians. We also want to see more tree planting in the right place and using large canopy trees wherever we can. Remember, to get those extra tree canopy, to get the extra benefits of trees from the tree canopy, wherever we have space, we need to be using large canopy trees. We want to increase the diversity of trees. Ash right now represent 13% of our public trees, and that we want to increase that. But if we look at this chart, we still have a 10% elm, but we have an awful lot of maple and linden, and we just need to be looking at greater diversity of trees. And it's not because the park board and others haven't been trying. Trees in urban settings have a really tough spot, but we just need to keep trying more and more species and searching out those that will do well in our urban spots. And again, to identify strategic planting opportunities and to use the city's tree canopy tool. This is an example of what it is. Anybody can find it available online, either through the city or the park board's website. And it allows a neighborhood to zoom in on a particular neighborhood, see, like in this case, St. Anthony East has about a 32% canopy cover, but they've got 22% additional places. And then you can zoom in on individual blocks or properties and get a sense of, oh, here's a spot, 616, they could use some trees. What's the neighborhood or the city doing to help encourage that? And wherever we do these tree plantings, it's just important that we provide plenty of soil volume and increase the diversity. Also, the city has been trying various new state-of-the-art planting technologies. This is illustrating one called Swedish soil. And even though the photograph on the right makes it look like a typical tree planting pit, it's what's underneath that sidewalk is important. A very coarse granular rock material is mixed in with the soil. That gives the airspace and the places for the tree roots to go. And then the sidewalk is poured on top of that. And in the case of the elm tree on the, I think that, well, there were some elm trees, I think that's what that is on the left, that were planted with this technique. They would grow 2 or 3 feet in a year. So it was a very ideal kind of growing situation. So finally, I'd like to go over our recommendations. First, we recommend the implementation of the Park Board's ash canopy replacement plan. This is a plan over the next 8 years to remove 40,000 public ash trees and to replant them with a diversity of species. This isn't removing trees that already have emerald ash borer. This is trying to get ahead and replace a few trees on every street that has ash with other trees so that we won't have to go in and clear cut an entire block when the emerald ash borer hits. And to do this, the park board needs funding of the tree preservation and reforestation levy at $1.215 million annually. Secondly, we recommend that that a MPRB tree preservation coordinator be funded and hired. And this is a person that would work along with other city agencies to help protect existing trees from construction loss and failure, and give trees a seat at the table in capital projects, including participating in the city's project development review panel. Third, we want to see an increase in young tree care and watering, increased public watering, and we believe that the Park Board, along with the Fire Department, Public Works, and Conservation Corps, can work together to achieve this. We'd like to see the city use the Gov delivery system to email drought watering reminders to residents that have young trees adjoining their property, and probably also to neighborhood groups to try to rally them to help water trees on thoroughfares and commercial areas. And we would like to see the city and the park board implement timely young tree pruning to improve health of our trees and to save future dollars, as well as we encourage neighborhood groups to create volunteer tree steward networks to help water and monitor young trees. And our final group of recommendations is we'd like to see the city increase their funding for the popular city tree program. We'd like to see a continued increase in the number of large shade trees and fruit trees offered through the city tree program, and in general be doing more to encourage the replacement of private ash trees. So with this, I'll invite you to have any questions, and I thank you for your time. And I'm just going to go backwards and keep that recommendation list up there.
Well, thank you very much, and thank you for the outstanding presentation. You certainly, we certainly are lucky to have you on the Tree Advisory Committee, and the PowerPoint was fantastic too, and it's something we might want to have linked up online so that everybody could see it later, so that would be great. I think we do have some questions. Councilmember Johnson.
Thank you, Mr. Chair. So I notice on the bottom of the slide here, increasing the number of fruit trees. And I'm wondering if there's a concerted effort around fruit trees in the boulevard and how that might tie into some of the work that the Food Council is doing. And it's actually kind of interesting. There's a website out there that I saw where they've actually mapped out public fruit producing plants and trees and just encourage people to go and forage, which I'm not sure if that's entirely legal or not, but it's an interesting concept, and I wonder how we can potentially contribute.
Talk about any policy implications of that. I think that is something that many cities across the country have really wrestled with as they want to increase our self-sufficiency, or at least move us in that direction in the city. And certainly fruit trees are important. The city tree program is putting them on private property where they may get better care and have better ability to produce the kind of food we want. But whether they have a role also on the boulevards, I'll let our city forester respond to.
Good afternoon, everybody. I'm Ralph Sievert from Park Board Forestry. This year, we'll be planting about 100 fruit trees in parks. Most are at Lindale Farmstead Park and at Weber Park, where our Arbor Day is going to be on May 14th. And we've kind of gotten up to 100 fruit trees from 2011, where we planted maybe about 9, because at that time we were just kind of phasing them in to see what the acceptance was and everything. So, but we have not planted and don't plan to plant on boulevards just because of the potential mess that can occur on the walking surface of sidewalks and that sort of thing. So this year, the 100 fruit trees are going to be probably in about, I'd say, 8 or 10 different parks throughout the city in different locations. So we've been kind of working in little groupings of them so that they're kind of available to everybody. And it all kind of fits in with our Park Board's urban ag plan that is looking at fruit trees as a component of that plan. And then the idea is to link to some organizations like, I think like the one you had mentioned, where they can work with volunteers to help cultivate those trees, because in some cases they just require a little different kind of maintenance than what we typically do on trees in parks and on boulevards.
Great, thank you.
Councilmember Cano.
Thank you, Mr. Chair. Could you maybe go back to the pie chart on your presentation?
That one?
Yes. So the recommendation is plant smart.
Sorry, it was
Yeah, thank you. You're talking about diversifying the types of trees. And so could you talk a little bit more about that? Sort of what is your specific recommendation, and how many of these trees, and going back to Councilmember Andrew Johnson's question, are fruit producing trees that people can eat the fruit that is produced by any of these trees? I'm trying to think. I mean, the one I see obviously is apple, if you're referring to like a real, like the commonly known apple tree, or are you talking about something else?
Thank you, Mr. Chair and Council Member. The Park Board put together this slide, so I don't know the specifics of it. So I don't know if, by referring to apple here, it's crab apple or more edible apple. Mm-hmm. And there are other species of trees, such as the June berries, which are very good eating trees as well. As far as what we are meaning by increase a diversity of trees, there are a number of species that haven't been used as much on our boulevards that could be used more. You see here at the top of this chart, coffee tree, birch, buckeye. Those are examples of trees that could be used more. We could be using more oak trees. There are some varieties of trees, and I'm going to ask Ralph to come back up here, that the park board has been experimenting with that I think we want to see planted more. So part of what it means is when the Boulevard Reforestation Plan was initially done in 1976, the attitude at that time was it made sense to plant predominantly one species on a block and then mix up the species from block to block or from street to street. What we're doing now is encouraging 2 or 3 or more species on each and every block so that we'll continue to have some canopy on every block. That being said, where we have very, very narrow boulevards, there aren't a lot of trees that will tolerate that kind of situation. So Ralph, do you want to say something about some of the trees you've been trying?
Yeah, and on the graph, the apple does include crab apples and apples, but apples, and this also includes not only street trees, but park trees. So you could find an apple tree occasionally in a park already. There's some, for example, at Falwell Park. And then the other category would probably be where you would find the small number of trees we've been planting recently, like apricots and plums and cherries that are edible. But the number is so small that it fits in that other category. And probably for the last, formally for the last 4 or 5 years, but probably more informally for the last maybe dozen years, we've had a relationship with the University of Minnesota, which initially started out with looking at disease-resistant elms, but it's kind of grown from there to look at not only different types of trees, but different planting methods, which ones are more successful in terms of establishing that new tree. And so some of the ones we've been looking at recently are things like there's a Prairie Horizon Manchurian alder that is developed out of North Dakota State University, and we've been looking at different types like that just to kind of get more variety out there. And Peggy is correct. The smaller numbers you see there are trees that do well, but they just haven't been used in the quantity that we could have been using them. Like bicolor oak is another example of that.
I had a follow-up question. So thank you for that. You talked about planting 100 fruit trees in parks, and I would just like to support that initiative and also say that in my ward that's very much needed. Powderhorn Park lost a lot of trees in the storm that happened, I think, last summer, and we've talked a lot about how can we, through a food justice and food security angle, support the planting of more fruit trees in areas that typically have low access to fresh foods. So folks would typically just walk to the corner store to buy, some packaged foods or, something sugary. And we're trying to make sure that our communities, specifically those communities that are low-income communities of color that don't have access to buy food at the co-op or to buy fresh foods at a local grocery store because it's too far or they don't have the ability to get there, to really encourage us to make sure that we have fruit trees and edible trees around their vicinity so that they can better engage with local fruits and make sure that they can just walk up to a tree and maybe get something that they could snack on. And so I know that that kind of effort takes time, and you're talking about the boulevards and the potential, I can't remember what you called it, did you say mess? Or so I think that would be a good way to approach the neighborhood associations in helping them to help you to talk about this project and initiative and seeing if there could be sort of a adopt a tree program on the block level. So there's somebody that's promoting the fruit tree and encouraging neighbors to help clean up, because I can kind of see how that might happen, but I can also see how it could also be a really positive thing for the neighborhood and offer another opportunity, as you were mentioning, for community building. So I just really want to say that I'm a strong supporter of fruit trees, and I would like to see more fruit trees in the parks, in low-income neighborhoods, and in neighborhoods that have been labeled food deserts.
Okay, thank you very much. And Councilmember Frye.
Thank you, Chair Gordon. First, thanks for all the great tree work that you're doing. Second, I know there are some neighborhoods in this city, and the specific one that I'm thinking of is the St. Anthony West neighborhood that is losing literally like 85 or 90 in some cases % of their trees, specifically along the boulevards, to emerald ash borer. And I know that you have a plan in place. So I'm just trying to find out the best strategy, whereas as these trees are cut down, to replant as soon as possible. I know I've talked with Ralph, and there's sort of a gap in between when the knockdown happens and then when the next tree is planted. I just think it's incumbent on us to make sure we get them replanted very quickly, because 85% is a major hit. So I just wanted to know sort of the strategy is how we're working on that.
Yeah, I think, as a person who has lost virtually all the trees on our block, it is something you want to see that replaced right away. So the trees get removed in the winter or late spring. Then the next step is for the stumps to be ground out, and then for the trees to be replanted. And, it may, so typically you get your new tree a year after you lost the old one. And I think that by having more funding to have the staff and the trees to do more tree planting and to get those stumps removed would certainly help speed it up. But there's there still is, a timing that happens. I guess I'm going to invite Ralph again to talk about whether there are other ways that it could be sped up.
Well, and one of the things that'll be a little different from this point forward, as our ash canopy replacement plan goes into effect, is that instead of waiting for just the winter time to remove ash trees, we're actually going to be doing them from pretty much mid-June on, because we have so many that we're trying to get out within a short amount of time. So we kind of have two different things. We have the known infested trees, and those are discovered in the wintertime, because that's the ideal time. The leaves are off the trees and the woodpeckers are doing what they do to indicate that there's a larva in the tree. And we do that with the Department of Agriculture. And then when those are found, they're removed, and before the larvae actually hatch and the beetles come out, so in other words, before the growing season starts. The preemptive removals, let's call it, from the plan, those will actually be starting in June and could be removed any time after that. So any of the trees we plan on removing this summer, they would be replaced in the spring. The trees we removed last winter, the goal would be to replace those in the fall, because right now the 6,100 trees we're planting this spring have all been locked in terms of the orders, where we buy them from commercial nurseries all over the country, and that's all done last fall to get ready for this spring. So I guess the worst case scenario for the folks who have those infested removals is going that first summer before we can plant them in the following fall, because that gives us the time, as Peggy said, to get the stumps out and also kind of get the next order in that we're going to use for the following fall.
So if you had sort of the maximum amount of money, if you had as much money as you could possibly want, which you're not going to get, I'm sure, but if you did, what would the strategy change, and would you be able to get trees up faster after they're knocked down? Or is there some sort of limitation based on the ecology or some practical limitation that I'm not aware of?
It's kind of a combination of our capacity in terms of the 6,100 trees we're doing this spring are the most we've done in probably decades in terms of planting. So there's a little bit of the capacity of our folks to do the planting, but then also just the bureaucracy of buying trees in quantity through the competitive bidding process. And then also the steps, because when we're removing stumps, we're removing lots of stumps all at once. So it's all really pretty much just the sequencing of things in terms of the season that trees are planted, whether it's because they're only planted in the spring or in the fall. And then just having the mobility to get that many trees done in mass all at once.
So I guess my question is, if you had unlimited money, could you feasibly knock down a tree, grind up the stump, and then put in another tree like the same day? I'm saying.
If you had unlimited money, you could do all kinds of things. Yeah, right. Yeah.
Okay,
Thank you, Councilmember Fry. And I just wanted to be clear then, so the plan for this year is 6,100 new trees being planted on public parks and boulevards?
Well, that's for the spring,
Okay,
and then an additional 1,700 in the fall. So
Okay.
it's 7,800 for the year total. And that includes then the replacement from the storm damaged trees from last summer as part of that.
And that's all public trees, so we also
Right.
want to encourage private tree replacement and removal.
Right.
And
Right.
and I understand the recommendation for increasing our tree program that we have, the city tree program. Councilmember Bender also has some questions.
Thank you, Mr. Chair. I wanted to ask about the tree advocate that you were recommending and talking about giving trees a seat at the table in project development review. I just wanted to clarify, did you mean there the review process for larger development projects in the city, so our PDR process?
Yes, council member, thank you. Yeah.
Great. A couple of things I thought might be interesting. So I serve on the Planning Commission, and we've been having folks come and talk about different areas of interest. And so I thought this might be a potential topic for a Planning Commission Committee of the Whole meeting. Because as an interim step, we could talk about ways where the Planning Commission could look for these issues when we're reviewing projects at Committee of the Whole. Because most projects come through there first for our recommendations before they do the their official submittals. So I wanted to throw that out there and be happy to follow up with other ideas as well.
Thank you very much.
I think that's a fantastic idea, and it would be great to have somebody from the tree advisory group just kind of come and tee it up for Committee of the Whole so the Planning Commission can start to get that in the reference. So I appreciate that. I don't believe there's any other questions or comments. Really appreciate the report. And I have a staff direction, and which really is, I guess, not a staff direction. It's a direction to the Tree Advisory Commission, and hopefully it will be received well. I understand you're technically, I guess, a commissioner of the Park Board, and I'm not sure about our authority here, but we have asked you to give us advice in the past, and we could use some advice now. So I have a direction I'm hoping the committee will support, which is to get a report back from you by about June 2nd. I understand that works in the rotation of your meetings, with a recommendation about how we can use some funds that we have set aside to maintain and increase the tree canopy. So the last couple budgets, the council has set aside significant money, and now we have over $400,000 left, $4,043,140.34 is what I hear we have left in this fund, which we set aside into property services. And property services is a small division up in finance, and they help buy trees for fire stations sometimes and things like that. But they really need some help figuring out how to get this out. And I learned that it was kind of stuck in line because they weren't masters at how do we get this out, how do we decide what to spend it on, where should it go. The council needs to help them. And we're not experts on it either. So we'd like to turn to the Tree Advisory Commission and see if you can help develop some recommendations about how best to use those funds. I think we've heard, at least from one council member here, some stub grinding, some of those other things might be a great way to do that, but I'm assuming that that's something that you're willing to take on and maybe heard about already?
Yes, yeah. Thank you very much, Chair Gordon. Yes, the Tree Commission would be very happy to look at that. We'd like to spend some time at our May meeting and be able to get back to you in June, coming up with some specific ideas for that.
Well, wonderful. And I'm going to consider that a motion, and you should have a clear version printed out, and I'll make that motion. Are there any questions or comments on that direction to the Tree Advisory Commission? Seeing none, all those in favor say aye. Any opposed? Okay, that motion carries. And I just thank you so much for all your good work, Ms. Booth and Mr. Seifert. You are real experts. I also just wanted to note how gratifying it is for me to hear that you're working well with Public Works. And some of the examples that you showed in the PowerPoint were significant, and some of them were fairly recent. I happen to know the one elm tree with the sidewalk around it. It wasn't just that we were driving around and thought it might be a good idea to do something there. It was actually the homeowners who got their assessment for their new sidewalk coming in contacted us and said, what can we do to make sure that the new sidewalk doesn't hurt this tree we've been working hard to save? And so I know that they really appreciated that. Public Works working and the Forestry Department coming out. I think we had an on-site meeting. We were both there. Yep. So it was fun to see that, and I really appreciate that and all the good work that we've done. And one last question I just remembered. You mentioned the tree canopy. Is our information online when people go and look that up about their neighborhood and their block? How up to date and current is that? Do you know?
Yeah, thank you for a good question. You know, it represents what the canopy was when the university was hired to do an interpretation of it. So I would say, was it about 3 years old?
I think it was in.
Oh, okay. So it was based on older imagery from 2007, 2008. So it would be very helpful for us to be able to get that done on a regular basis, because it is certainly going to change. I just, one of the areas in that tree canopy map that showed the highest tree canopy cover at the time that was done was Prospect Park, and yet that's had the highest incidence of emerald ash borer. So I'm sure their statistics have changed, and I would imagine we'll be seeing changes in other communities as we get more EAB.
I appreciate that. I was worried that it was pretty old information. It would be something to refresh. And if we haven't taken care of that before your annual report next year, we'll expect to see that in one of your recommendations.
Okay, thank you very much.
Well, now we're ready to move on to our next item. I see that staff's even more ready than I am. Welcome. Now we're going to talk about the Healthy Living Initiative. If you're all set, why don't you go ahead and introduce yourself, Laura, and get started.
Good afternoon, committee chair and council members. My name is Laura Pratt, and I manage the Healthy Living Initiative at the Health Department. And my job today is to tell you a little bit about the approach of the Healthy Living Initiative, our recent accomplishments, our current work, and opportunities for council leadership. The Healthy Living Initiative works with community partners to create opportunities for people to eat healthy, be physically active, and live tobacco-free. It is a collection of 23 different projects aimed at helping residents live longer, healthier lives, free from the chronic diseases that are caused by obesity and tobacco use. Our projects focus on healthy eating, opportunities for physical activity, tobacco-free living, and high-quality health care. Our work is funded exclusively with grants, and it is advised by a community leadership team made up of members from academia, community and cultural-based organizations, and other city departments. In fact, I'd like to recognize Dr. Melissa Laska from the University of Minnesota, who's on our community leadership team, he left, as well as Robin Garwood, who was right behind me. While there may be some issue fatigue related to obesity and tobacco use, they really are ongoing crises in our community. In Minneapolis, 19% of adults are obese, and another 29% are overweight, and 6% of our kids are obese. In terms of tobacco use, 16% of adults smoke, and about 15% of teenagers smoke. So relative to the state and the nation, definitely, these Minneapolis statistics are actually pretty good, but they mask the huge disparities that we see because obesity and tobacco use varies greatly by income, race, and neighborhood. For example, 1 in 8 low-income children is obese, and 30% of near North and Camden residents are obese. If you add to that the other 30% that are overweight, that means that only a third of residents in North Minneapolis are at a healthy weight. And that has debilitating and expensive consequences for that community and its residents. In terms of tobacco use, low-income residents are 3 times more likely to smoke than higher-income residents. So obesity and tobacco use are placing a huge burden on all sectors of our community. Type 2 diabetes, for example, it used to be an adult disease. But children and teenagers are increasingly diagnosed with type 2 diabetes. And these kids are going to live shorter, sicker lives. There's just no doubt about it. And that's bad for them and bad for our community as a whole. People with chronic disease are more expensive to employ here in our own city of Minneapolis, but in any other employer as well, due to higher medical costs, lost days of work, and lower productivity. And our healthcare system is certainly buckling under these costs. For example, the cost of treating diabetes rose 41% in 5 years, from 2007 to 2012, to a nationwide cost of $245 billion to treat diabetes. So with an aging population and more people getting diabetes at younger ages, these costs will increase even more. But thankfully, this problem is fixable. Obesity, tobacco use, and the diseases that they cause are entirely preventable. Our solutions begin at home, but they are reinforced, or not, by external factors in our neighborhoods, our schools, our work sites, and our broader community. Individual and parental responsibility for healthy living are absolutely essential. But to quote the Institute of Medicine, it is unreasonable to expect that people will change their behavior easily when so many forces in the social, cultural, and physical environment conspire against such change. So educating residents and hoping that they select the healthy behaviors are certainly important, but the public health approach, and certainly the approach of our Healthy Living Initiative, is to create sustainable improvements that make healthy behaviors possible. So here are some examples. Smoking rates and exposure to secondhand smoke declined dramatically when we as a society eliminated smoking from workplaces. And the city of Minneapolis was actually a leader of this in the state, passing one of the state's first freedom to breathe laws. It's hard to expect people to buy healthy food when they lack transportation to the good stores and their nearest stores are filled with chips, candy, and pop. But efforts such as the city's own staple foods ordinance, which requires grocery store licensees to carry a minimum amount of actual food, can help residents have access to healthy food and make a healthier choice. Car-oriented communities discourage active transportation, and Minneapolis residents are certainly blessed with an amazing infrastructure for biking and walking, but it's not equitably distributed in our city, and other factors such as safety impede people's ability to use it. And then the proliferation of nutrient-empty and foods and huge portion sizes are contributing to obesity, while access to healthier options at schools, work sites, even home, and social norms that support these types of healthy beverage consumption will contribute to health. So the healthy living approach reflects the examples that I just showed you. We work on changing practices, systems, and environments versus educating individuals. We focus on health equity. We engage residents in defining and pursuing solutions, and we develop strategic partnerships. As I mentioned, the Healthy Living Initiative is a collection of 23 projects aimed at healthy eating, physical activity, tobacco-free living, and high-quality health care. To achieve healthy eating, we have more than a dozen projects, all aimed at increasing access to healthy foods in the settings that are listed here. As a result of our efforts and our partnerships, all large and most mini farmers markets now accept EBT so that low-income people can buy fresh, locally grown produce. Users of our amazing park system now will have access to healthier foods because of the food policy that we help them pass and implement. Through the leadership of Homegrown Minneapolis, the City Council passed an urban ag policy plan that updated zoning codes that now make it easier for urban agriculture. And hundreds of charter school and Minneapolis public school students eat more fruits and vegetables every day because of the salad bars that we provided. We work in food shelves, and now they have more and more consistent options for procuring fresh produce and other healthy foods for their clients.
and corner stores are now offering healthier foods through the support that we provide to owners. In the areas of increasing physical activity, we work on creating safer streets for senior citizens living around Minneapolis public high-rise buildings, and we're working with residents in Phillips neighborhoods to address some safety concerns and to do some visioning and planning around a safer Franklin Avenue. We're also supporting efforts to increase physical activity to and from school and during the school day at Minneapolis public schools and charter schools. In fact, this looks like today. This morning, buses dropped off 300 students from Northrop Elementary School. They dropped them off at the creek, and they were met by volunteers and teachers, and they walked 0.6 miles to school, arriving energized and ready to learn. This happens every week at Northrop Elementary School, as well as 4 other schools in the district. The Health Department, Public Works, and many community agencies are also conducting a planning and community engagement process to determine the feasibility and the desirability of a greenway in North Minneapolis that would provide car-free opportunities for active transportation and recreation. They're doing door knocking, they're community events. In the area of tobacco-free living, we have 2 bodies of work. One is to reduce exposure to secondhand smoke, and the second is to reduce access to commercial tobacco products. Recent accomplishments include supporting the passage and implementation of smoke-free building policies at Riverside Plaza and Minneapolis Public Housing Authority high-rise buildings. So collectively, these 2 projects alone have reduced secondhand smoke exposure to more than 10,000 low-income residents. We also work to link these residents to the cessation supports that are available to them in the community. We're also working to address the challenges posed by new and emerging tobacco products, such as e-cigarettes and flavored cigarillos. Specifically, we're working to update our own City of Minneapolis tobacco policy, and we're working to protect kids from cheap and dangerous tobacco products by strengthening protections in the retail environment. We work with 4 clinics to improve the counseling, referral, and follow-up for patients who are overweight or smoke. And likewise, we're increasing linkages to and the reimbursement of clinic and community-based prevention services. So there's a lot of different programs in the community for healthy eating, physical activity, smoking cessation, but there's some issues related to reimbursement, and clinics need to know about them, and people need to be reimbursed to provide these services so that people can get the care that they need.
Excuse me, could you tell us what 4 clinics those are? If you happen to know, and if you don't, we can find out later.
Yes, Patty?
They're the Native American Community Clinic, Broadway, and People Center, and Children's.
So if people were listening at home, they probably didn't hear that.
Oh, I can
So
repeat them.
that- okay.
Broadway Family Medicine, Children's Clinic of Minneapolis,
People's Center.
People Center, and Indian Health Board. NAC, I'm sorry, Native American Community Clinic.
Thank you.
So all of these 23 projects really are serving 2 main city goals. Living well. Under living well, we strive for neighborhoods with the amenities to meet daily needs and live a healthy life. We strive for high quality and convenient transportation options, including non-car options, and ample recreation for residents. And under One Minneapolis, we're striving to eliminate the racial inequities in health by providing all people with opportunities for success at every stage of life and every setting, almost every setting where they interact, such as childcare, their schools, their neighborhoods, and their work sites. The keys to our success so far are an incredible staff, and I would like to introduce you to them because I think you're going to be working with them over the next couple of years. If you could stand, please. So starting over here, Kristen Klingler leads our food access work. Nora Heft works on our corner store program as well as our food shelf and meal programs. Sarah Rubin has worked with the park board to pass and implement the park policy, and she also works with work sites and the charter schools. And then also we benefit from the amazing leadership of Gretchen Musicant and Patty Bowler. and I work on the tobacco projects and overall management.
Well, thank you all so much.
I'm sorry. Oh, she's not there. Oh, and Sarah Stewart also leads the active living initiatives. Also key to our success are the community leadership team that I mentioned and funding. I mentioned that we are entirely grant funded and we're really good at it and successful, but we're also dependent on it and fairly vulnerable because of it. Other keys to our success are resident engagement and partnerships. Everything that we do is really through community organizations or directly working with them. And here's just a list of some of the departments. Many of them are city departments, as well as quasi-governmental institutions and lots of community-based organizations and cultural-based organizations. The City Council has been a powerful ally in the healthy living work over the last 6-7 years. In fact, there's some upcoming opportunities for council leadership. We hope to engage you in the near future, your insight and your leadership on a number of initiatives, including a revision to the Staple Foods Ordinance, an update, as I mentioned, to the city's tobacco policy, and perhaps even some ordinances related to e-cigarettes, policies to reduce tobacco-related disparities. Hopefully, the council will have the opportunity to vote on the North Minneapolis Greenway at some point, and a complete streets policy. So with that, I think I will end and leave it for questions.
Well, thank you very much. That's a great list of very exciting projects. I don't see any questions right now. But I'm just amazed with all the work and all the accomplishments you do. And maybe I'll just ask, well, maybe I won't ask a question, but I will acknowledge, I think something that's pretty unique and challenging with this whole healthy living effort is the interdependency, and you kind of was alluded to with the all the different organizations you work with, but even the dependency and the relationships that you need here in City Hall just to accomplish the work that you want to work in and get done. And I think sometimes that has created some challenges. But that's also an area where I think that the council members can help play a role too. Because somebody might look at the complete streets policy and say, well, why is the health department getting involved in that? Or somebody might look at land use, like where can you have a food manufacturing place, or what can you sell in a grocery store, and wonder, what's the health department doing there? And I think you made a very good case that what you're doing is you're helping bring in some outside resources to create some more opportunities so that we can really do more and accomplish more working in those departments. And so I probably said that more for myself and my committee members than anybody else, so there's no need to respond there. I think all that we have to do right here is receive and file your report, and also thank you and your small but mighty staff for all the accomplishments that you've done.
Thank you.
So on that motion, all those in favor say aye. Any opposed? That motion carries, and that means we're ready to move into our final agenda item, which probably won't take that long, but is a big step that we've been working up to for a long time, which is pursuing national accreditation status for the Minneapolis Health Department. Welcome.
Hello, I am Margaret Schuster, and I'm a senior public health specialist at the health department, and I'm actually their accreditation coordinator. So I am here to give you a presentation about our accreditation effort, and then to ask for your support, specifically through a resolution that you have in front of you, as that is part of the requirements for accreditation. So I just want to recognize that accreditation is public notice that an institution, a program, or an agency meets or exceeds the standards that are set forth by the accrediting agency. And it's a process whereby that agency or program or institute commits itself to studying itself, assessing itself, and also allowing external partners and one's peers to review their work and actually decide whether it meets or exceeds the standards. The other thing that accreditation does for us, anyway, is it formalizes all the good things that we're already doing, and I'll talk a little bit more specifically about that in a slide or two. And it's looking at ourselves as a way of continually developing, revising what it is that we're doing, and improving, especially in the administration of public health for all Minneapolis residents. Accreditation has been around and in many other fields, social services, schools, healthcare agencies, and camps, but it's new to public health. So again, in the next slide, I talk a little bit about who the accrediting body is, but currently at every level, accreditation is a voluntary effort, and it's being asked of state, local, tribal, multi-jurisdictional, and so this is a new effort, and the Minneapolis Health Department has decided to go down that road and take those steps towards national accreditation. Recently, the Minnesota Department of Health submitted their application. Hennepin County has also submitted their application, and they've actually received their accreditation already. So who is actually accrediting us? It's called FAB, the Public Health Accreditation Board. They were established in 2007 and really founded with the express goal of advancing public health performance, strengthening public health across the country and at every level, and encouraging continuous quality improvement and ongoing identification of best practices so that good public health and how it's done isn't kept a secret, but that it's able to be accessed by departments like ours, where we can call even national partners and say, well, how are you approaching this? And that there would actually be an accrediting body who would help facilitate those resource connections. It's also a national framework of standards that were developed and then published in 2011. So it did take over 10 years actually to get to the point where they published the standards. So again, this is a new venture for all health departments. The first health departments were accredited actually just last year, March of 2013. So it took a couple of years even after the standards were published for the first health departments to be accredited. And currently, as of the end of March 2014, out of the over 3,000 health departments that there are nationwide, 31 have been accredited. So you can see how new this venture actually is. There is, along with the national structure and organization, there are fees associated to manage and maintain the accreditation process, and they determine that fee structure based on the size of the jurisdiction that the health department actually serves. Even though we realize that there's a cost to preparing for accreditation, we believe that the investment is a good one to make because it not only improves and advances the quality of our work, but it might actually give us that competitive edge and leverage in securing additional funding in the future. It's actually a 7-step process, and we are just on the verge of submitting our formal application, which would be step 2. So for the previous 18 months or so, we've actually been in sort of the pre-application phase. We have an accreditation steering committee that helps lead the various divisions across the department. And we submitted our statement of intent to apply in December of 2013. Now we're ready to submit our formal application, which is actually what brings us here today, because support from the City Council as Minneapolis's Board of Health is required for the formal application. Once accreditation is achieved, we actually have that status for 5 years under the current standards that we're operating. During that time period, there might be revisions to the standards and improvements. If we see that we would like to be reaccredited after that 5-year period, then we would obviously have to be reaccredited according to perhaps a new set of standards. Or revised. Revised would be a better word for that. So why should we actually do this? The city and Minneapolis Health Department are already doing work that aligns with accreditation in terms of tracking trends, the results Minneapolis work, having department business plans that align with the city goals. All of those things are required for accreditation as well. The merger that we had last year with environmental health fit nicely with those activities as well. Since we went through a strategic planning process, we developed a new mission, a vision, values, and department goals, updated our business plan as a result of that. In Minnesota, the accreditation process also coincides nicely with the reporting requirements to the Minnesota Department of Health. So at the state level, we are actually required to do much of this work as well. So we have to do planning, assessment, a department strategic plan, and a quality improvement plan as well. So our feelings kind of are, if we're doing a thorough documentation review and assessment for the city, also at the state, why not sort of get the best bang for our buck and get a national accreditation as well? Most importantly, accreditation is an achievement. It provides credentials. It says something about our willingness to go through the process and to have others look at our work and actually review that. And funders are looking critically at every applicant, so it's believed that there may be some advantages for those departments that actually seek accreditation in the fact that we would stand out above the rest, perhaps, and that accreditation might actually become the norm. So at this point, although it's voluntary, there may be moves towards a requirement for accreditation at some point. There's also a good focus on quality improvement. So having others look at our work provides our health department with valuable, objective, measurable third-party feedback. And that helps us. So it helps us improve the quality of what we do, how we do it, and again, given the current economic and funding climate, accreditation and quality improvement can lead to increased efficiencies and yet maintain or even improve the integrity of the work that we do. So some of the things that we've actually done already, I mentioned that we went through a strategic planning process. So we developed a department strategic plan. We submitted our statement of intent to FAB in December of 2013. And we have an accreditation steering committee still meeting. But another requirement is to have a quality improvement council, and they began meeting earlier this year. We actually had a support grant from MDH to help us do some training with our quality improvement council, and that's been very helpful. And we're hoping to then send in our formal application to the accrediting board by the end of May of this year in order to get in on the standards that we've already been studying for 18 months. As a part of your role as City Council, we know that the accreditation process can be intense and that there can be some payoffs, but we also know that our formal application is going to require support not only from our department leadership, which they've already shown by engaging in this process for so long. We also need support from the mayor and from the City Council as our Board of Health. So we're asking for your support specifically in the form of a resolution, which indicates that you are sort of on board with us in support of our formal application. Another requirement is that down the line, once we send in our application and submit our documentation, there will actually be some site reviewers who will come from FAB for a 2 or 3 day visit. During that time period, they will want to interview community partners, they'll want to interview people from the City Council, they'll want to interview our own department leadership, the accreditation team. So there will be kind of a rigorous review, on-site review of everything that we've actually already submitted at that point. And so that would be important for you to know that that would be an expectation.
Do you know roughly when that would be occurring?
Probably the fall of 2015.
Okay.
Then the FAB board itself would take about 6 months. Maybe by that time they'll be a little bit quicker in their awarding their accreditation announcements, but at this point in time, it's been about 6 months. So from the time that the site review has happened until a health department actually finds out if they're accredited has been about a 6-month time period. And then after that, of course, we would love to celebrate that news with you and then come back and give you a report about what that process was like, what we learned about ourselves in the meantime, and be able to move forward from there. This just lists some of the online resources. Some of those are national organizations. The first one, of course, is the Public Health Accreditation Board. The Minnesota Department of Health has also been very helpful with us, and so they have some excellent information on their websites. And I just want to say thank you for the opportunity to talk about our efforts, and I'm wondering if you have any questions.
I don't see any questions. We, I think, have been getting information about this along the way, and it's exciting that it's finally at this point.
Yes,
So,
we're excited too.
Yeah, I appreciate all your efforts and being here today. And I'm happy to move forward with the receive and file and also approving the resolution. Did you have a question, Councilman Fry? Okay.
Thank you, Chair Gordon. And thank you for your time. It's not a question directed towards you. I have, I guess, a slight amendment to the resolution. I want to make sure that when we look at increasing the tree canopy in Minneapolis, we're also looking at park board lands as well.
So I'm going to say we voted on that staff direction a while ago, so why don't you hold that thought? Because maybe we can come back and move to reconsider, and if there is an amendment, because the resolution we're looking at now is to go ahead and pursue national accreditation for our health department.
Oh, okay. I'm
It's the
looking
last
at the
item
different
on the
resolution.
agenda.
Okay.
Yep. If you get paper in front of you and all
Yes,
that
thank you.
stuff happens. So why don't we, so there aren't any questions on the motion before us, which is to receive and file this report and move and support the resolution for pursuing national accreditation. All those in favor say aye.
Aye.
Any opposed? Seeing none, that motion carries. Thank you so much.
Thank you so much.
And now, Councilmember Fry, do you think we should open up that staff direction and add something about the park board?
Yeah, I would like to add just language so that it's clear that we are also including park board lands and specifically boulevards, because I know in terms of the deforestation, the vast majority of it is happening on lands that are held by the park board. So, you know, when we're talking about the CLIC money for this $443,000, I just like some of that money to be incorporated on that park board land, and if that could be addressed in there, that would be great.
And I think that was totally the assumption. Sometimes that's where we can make the most and easiest difference. I don't think anybody thought we should try to get all this money into private hands, although I think I'd be open to how could we support people who can't get trees removed from, doing some in private. So we could put a comma at the end of that and say including or especially related to.
Especially related to lands held by park board.
Okay. The boulevards are technically city lands, but the park board manages the trees, so we could say especially related to boulevards in Minneapolis Park and Recreation Board land.
That would be
okay?
perfect.
Did
yes.
you get that, Peggy? Okay. Just to clarify, boulevards were part of it because that.
Thank you,
I don't
Chair
wanna get
Gordon.
Caught up in a legal confusion. I think that's fine with me to make that amendment. Any other comments on that? All right, on the newly amended staff direction then, now that we've lost our tree advisory commission, and they don't know what we're doing to it except for one member. And I don't think that member has any big concerns. All those in favor say aye.
Aye.
Any opposed? Okay, that amended staff direction passes. And seeing no further business before us, this meeting is adjourned.